let's kind of start with this particular session. So today what we're going to talk about is the medical management of BPH. Now, as a surgeon, you are bound to get patients of this. I mean, yeah, I get it. Like there is a super specialization in the urology, but many times patients do not realize. And let's say if at all you're working in a government hospital, maybe there's no separate department of urology at this point of time, and you are bound to get patients with such complaints. Okay. So first, let's try to understand how will you suspect that the patient is having a benign prostatic hyperplasia? So just to enumerate, very, very basic, obviously, not into a lot of depth, but yeah, what are going to be the, what do you call as the symptoms? Symptoms suggestive of BPH, or obviously the patient is not going to walk to you and say that, what's that, I have BPH, give me medicine for it. Obviously not, right? The patient is going to come with some or the other urinary complaint. So point is, my point is that what are those particular complaints with which, when the patient comes to you, he will or you will think in the terms of BPH, benign prostatic hyperplasia. Okay. So, what is the first thing that the patient is going to tell you? That poor flow. Okay. Obviously, the patient is not going to say poor flow. Patient is going to say in Hindi that जो पेशाब का धार है वो कम हो गया है. जो जोर से आता था वो कम आता है. What the patient is trying to tell you is that the flow of the urine has reduced, the girth of the urine has reduced. That is the first thing which the patients are going to tell you. What else the patients might tell you? That डॉक्टर साहब बहुत जल्दी जल्दी जाना पड़ता है. पहले तो 3-4 घंटे बाद जाना पड़ता था, अभी 1-2 घंटे में ही जाना पड़ता है. तो what is this called as? This is what is called as an increased frequency. Okay, increased frequency. Now, increased frequency can be because of a number of reasons, but yes, BPH is one of that. Okay, so let's try to understand this. Okay, what else the patient is going to tell you? That अगर मेरे को पेशाब लगता है ना, मुझे दौड़ के जाना पड़ता है, और कभी कभी अगर मैं दौड़ के नहीं जाऊं तो हो सकता है यूरिन लीक हो जाए. ओके, सो व्हाट द पेशेंट्स माइट से दैट आई हैव टू रश टू द वॉशरूम, एंड इफ इट ऑल लेट्स से आई एम नॉट एबल टू फाइंड अ वॉशरूम इमीडिएटली, देयर इज अ चांस दैट द यूरिन माइट लीक. Okay, I hope you are able to understand this point. Okay, so all these are the symptoms which the patients are going to have. What is this called as? The last symptom which I described, this is what is referred to as your urgency and urge incontinence. Okay, so what is this called as? An urgency and urge incontinence. Along with that, there are others as well, like nocturia. What do you understand by nocturia? रात में उठना पड़ता है. Okay, रात में how many times do you get up to pulse urine? Probably none, right? So anything more than one is considered as nocturia. In these patients, they have to get up quite often, 2 to 3, 4 times nocturia. Okay. So all these are the symptoms of BPH. Now, every patient with a BPH is going to have all of them? No, not really. But these are all the symptoms of the BPH which the patients have. Now, if at all the patient comes to you with these symptoms, it's not like that 100% the patients are going to have some prostate problem, right? So in order to evaluate these particular patients, what do you kind of undergo? You subject these particular patients to uroflowmetry. Okay. Now, what is this uroflowmetry? What do you understand by this uroflowmetry? So when I was a surgical resident in my second year, my department got the uroflow meter. What is this uroflow meter? So in the uroflow meter, so my HOD was someone who liked urology. Okay, that's why I used to do all these kind of things. Okay, so yeah, let's kind of see. Okay. Bikesh, would you like to kind of unmute yourself if at all it's possible for you? Yes, you have unmuted yourself. Okay. So what is a Euroflow meter? Can you explain to me? What is a Euroflow meter?
There are machine connected to a cone-like object in which the patient urinates, which measures the rate of flow, the total evacuated volume, and the maximum flow rate.
Okay, good. So what you need to understand is that what he was trying to say is that there is a machine which is basically present, and it's not a machine, it's a Euroflow meter. That particular Euroflow meter is connected to a what you call as a computer, okay? And obviously the rate of flow of the urine which falls into this particular container is picked up, and what we get is a graph. Okay, so normal graph is this bell-shaped graph. Okay, so that is what you need to understand. But yes, you were absolutely right. This is what is a uroflow meter. Now, any disease in the urology we always get a uroflowmetry done. Okay, so that is something which is important. Now, what is going to happen in the patients with the BPH? In the patients with the BPH, the flow rate is going to be prolonged. Are you able to appreciate this? So this is a normal one. Okay, this is a normal. Over here, what is going to happen is that the flow rate is going to be prolonged. Okay, so prolonged flow rate, that is what is going to be there. Okay, so this is what is called the dampening of the Euroflow meter and all those particular stuff. Okay, I hope you have understood. So based on the prostate size and the Euroflowmetry and everything, you will say that, you know what, dude, you have got a BPH problem. That is, your prostate is basically too enlarged, and that is why your urine is getting obstructed. Okay. Now, the immediate response of the patient will be, okay, how do you treat it? So there are two ways of treating it. One is the medical management, one is the surgical management. Today, we are going to talk about the medical management. Okay. So I hope you have understood what we are going to talk about today. Okay. Now, before we talk about any further, I want you to just introduce you to this basics of the anatomy. Okay. Now, how many sphincters are there in the males? In order to prevent the urine from leakage, how many sphincters are there? So there are two sphincters. One is the internal sphincter, which is basically present at the bladder neck. The another one is the external sphincter, which is basically present around the membranous urethra. Okay, you got it? There are two sphincters in the males. Okay, rest all is fine. This verumontanum and all those particular things are fine. Okay, now if I ask you this internal sphincter, this is under the control of which receptor? Can you tell me, Bikesh? This is under the control of which receptor?
alpha 1 D, alpha 1 A.
Very good. Very, very good. So alpha 1 receptors. Okay, so what you need to understand is that this bladder neck, this is what is under the control of your alpha receptors. Okay, so we'll talk about that. Okay, good. Okay, then, okay, so this external sphincter, internal sphincter, they are basically under the control of your alpha receptors. Okay, that's fine. Okay, alpha 1 receptors. Okay, now what about the bladder? In the bladder, you have different types of receptors. You have M2, M3, then you have a like beta 3, beta 2. All these particular things are also there. So, what is the effect of muscarinic receptors and what is the effect of the beta receptors? If at all they are activated or stimulated, what is going to happen? Okay, so please try to understand this. Okay, muscarinic receptors, if at all they are stimulated, what is going to happen? It is going to cause, what is it going to cause? Increased contractions. Okay, so please try to understand. Stimulate the bladder contraction. If at all they are getting stimulated, if muscarinic receptors are stimulated, what are you going to have? You are going to have a bladder contraction. This stimulates the bladder contraction. M2 is a dominant type of that. Okay, so M2 is the one which is the dominant type, acetylcholine mediated. That's all fine. Okay, understood? Right? So stimulation of the muscarinic receptors increases the bladder contractions. What about the beta receptors? The stimulation of the beta receptors actually relaxes the bladder. Okay, so beta receptor, if it all is stimulated, it causes the relaxation of the bladder. Am I making some sense to you? Muscarinic receptor stimulation, it causes the bladder contraction. Beta receptor stimulation, it causes the bladder relaxation. Yes or no? Everything is clear till now? Vikesh, I hope you have understood.
Yes, guys.
Okay, good. Now we have talked about the alpha receptors. It basically stimulates the contraction of the sphincter. So yeah, all these particular things are fine. Okay. Now let's talk in terms of a case scenario. Okay. So there's a 52-year-old male patient came to the urology OPD with the complaints of poor stream frequency, 4 to 5 times in the day, nighttime sit smell, no urgency, no urgent continence. Okay. So yeah, that's what you need to understand. So what is the major complaint of the patient? Poor stream. Okay. Poor stream. So you do a workup of this particular patient on digital rectal examination. It is normal. Okay, so what you would like to check in the DRE? When I've written DRE is normal, what do I mean?
Prostate volume.